Today, we zoom in on a major headline surrounding the COVID-19 pandemic, starting with Russia's claim to have become the first country to complete a vaccine against the novel coronavirus. We also discuss how the virus is taking a toll on education for over 1 billion students across the world and whether children in the United States should return to the classroom. I have joining me Eric Ding, epidemiologist and senior fellow of the Federation of American Scientists. Hi there, Dr. Ding. Lovely to see you.
Hi, happy to be back.
And we also have Neale Mahoney, Professor of Economics and Policy at Stanford University. Hello there, nice to have you on again.
Great to be here.
Right, well, let's start with you, Dr. Ding. On Tuesday, Russia claimed to be the world's first nation to approve a COVID-19 vaccine for public use. But it hasn't been tested up to the global standard. So how are scientists outside Russia looking at the safety or efficacy of this vaccine?
I think what scientists have reacted this morning is just a complete outrage, surprise, stunned, because they completely skipped the phase 3, which is the mega stage of this randomized trial series that you're supposed to do when you approve a vaccine. And phase 3 is critical because it actually tests does it truly prevent the illness with high efficacy, because it can't just prevent it by a little bit, but also high efficacy, and is it safe in enough people? And in enough people is the key, because early studies and limited number of people just can't tell you that. And by skipping it, it is wholly dangerous and actually might fuel vaccine hesitancy. And naming a Sputnik after one of the Cold War, space war names is actually a really bad name as well. So altogether, it's too rushed and potentially too unsafe.
And Dr. Ding, how do you think they're going to prove that it actually works? And if it does, if it is somewhat successful, then would other countries be adopting that?
Yeah, so that's the problem. When doing the rollout, they're not doing a phase 3 randomization in which half the population gets placebo. They're just going to give it. So they won't really know how successful it truly is without that control group. And it will fuel the global demand and pressure on other governments to early approve their vaccines, which there's 135 vaccine trials at the moment. 8 are currently in phase 3, and by doing this, it puts enormous strain on other countries to rush approve their 8 phase 3 vaccines, and I think that's the wrong move.
So really, it could rather escalate a more unhealthy competition for this vaccine.
Yeah, and it could ultimately create vaccine hesitancy, which is very dangerous.
Well, Dr. Mahoney, Wall Street did briefly respond positively to the news of the vaccine, but it ended up finishing lower on Tuesday. Do you think this reflects the general skepticism over Moscow's claims?
Right, so there are lots of things that impact stock prices, but I do think we can read this evidence as indicating that there isn't a huge amount of excitement. Like the doctor said, there are 8 trials in stage 3, and this drug, for all intents and purposes, is at that stage as well. So I don't think this is a huge breakthrough, and the Wall Street reaction is reflecting that.
And Dr. Mahoney, the Russian vaccine, as Dr. Ding just mentioned, it was named Sputnik 5, and it's reminiscent of the then Soviet Union space race with the United States during the Cold War. Is Russia's announcement an attempt at winning what many are seeing as a vaccine race? And what's really in it for the country that wins?
Yeah, so I don't see this as sort of a winner-take-all competition, right? That we're in sort of the battle to come up with a vaccine, we're all on the same team. It would be best if there were safe and effective vaccines coming out of many countries. That's the only way we're going to have the supply to match global demand. That's the only way we're going to have different vaccines which have sort of side effects which allow it to be taken by the broad majority of the population. So I don't see this sort of as a race where Russia is trying to be first. This is a struggle where I think we'd like to have as many safe and effective vaccines as possible.
And would you share that point of view, Dr. Ding? Do you think there should be many vaccines being developed across many countries?
Oh, absolutely. There are wide, many versions and approaches to designing these vaccines. And some of them we've never actually successfully delivered a vaccine before. So I think having many versions, whether adenovirus, whether it's
Now, Dr. Ding, there was a report earlier this month that said that the number of children becoming infected by COVID-19 soared by 40% in the last 2 weeks of July. And we did have the assumption that children were less affected than adults. So what do you think is behind the sudden jump?
Well, I think the children being infected and soaring shows that children are not immune. Children, if anything, the rate has soared by 90% over the entire month of July compared to the previously. And the large study out of South Korea with 65,000 people clearly shows that families with kids 10 to 19 spread it just as much transmission as young adults, if not even higher. And even families with kids under 10 had a really significant transmission, even if it was somewhat lower. So the children are immune line is definitely not correct.
Well, your president was saying that children seem to be mostly immune, but I suppose there's every reason to suspect that assumption now. But well, Dr. Mahoney, this does come amid the debate over whether schools should reopen in autumn. And the Brookings model of the impact on school closures on the US economy assumes that 4 months of school closures would amount to a $2.5 trillion loss. And that's around 12.7% of your annual GDP. So what do you think of this model? And do you think potential economic loss is reason enough to send kids back to school? I mean, despite this recent surge of infections.
Yeah, so, the Brookings estimate of $2.4 trillion in sort of lost economic activity if students aren't educated, I think underscores a number of points. One is education is hugely important, but those estimates sort of assume that there's no opportunity to catch up. So if children are not in school this fall or maybe this winter, even with the best online learning, I think the quality of the education won't be as high. But that doesn't mean that opportunity for educating our kids is gone forever. I think what's important is over the next 5 years that we invest so that we can make up that lost ground. So whether that's hiring more teachers or having longer school days or having longer school years, I think there's a range of different ways to make up 4 months or 6 months of lost education. And so I think the real task is to make sure that we catch up and not sort of succumb to the fact that we'd have a less educated cohort of kids.
Right, so what you're saying is that it shouldn't be about the speed or rushing to get children back in school, but really helping them catch up once the appropriate time comes. And well, Dr. Ding, what are your thoughts on this?
Well, I think, kids who fall behind, some would argue, is much better than kids who are dying and endangering teachers. It's a very difficult situation, and it's exacerbating inequalities of wealth so much further, and racial inequality in the U.S. But I don't see a good way around it, because if we endanger teachers and endanger our kids, especially there's long-term health consequences, we can't repay that. The best way to reopen schools is by closing bars, is by closing sports games, is by closing a lot of the other traditional activities so that we can do it for our children.
And Dr. Mahoney, what do you see as some of the long-term risks of reopening schools prematurely at this point?
So, I'd love to hear Dr. Ding's view here, but my sense is we don't yet know some of the long-term health risks, and that's, I think, as a parent of a girl who should be entering kindergarten this year, I think that's my biggest concern, is that the things that we don't know, what are the long-term health consequences? Like I said before, I think there will be educational consequences of distance learning. That's particularly true, I think, for younger children. It's particularly true for low-income families. But I think there's more opportunity to catch up on the educational front. So what I'm more worried about is sort of the long-term impacts of COVID, which I think we're still only starting to measure.
And really, while Dr. Mahoney, the UN Secretary General Antonio Guterres has warned that the disruption to learning is turning into a generational catastrophe. And which groups of children and young people do you think are likely to suffer the most from the economic impact of lost learning and access to education?
So at least in the US, I think there's emerging data which is showing that low-income students, for example, have been getting behind on math, while high-income students seem to have been sort of continuing based on their pre-COVID trend. So I think that's a big concern of mine, that already existing gaps between outcomes for high and low-income students are going to get worse. I don't think that this is a hopeless scenario, that there are proven investments we can make in low-income schools and low-income children to improve their outcomes, but we need the political will to do it. I think young children is another issue in the United States. The ability for a 5-year-old to learn via computer is just greatly diminished relative to a 16-year-old. So those are my concerns, at least in the US context.
And Dr. Ding, what would your concerns be in terms of prematurely reopening schools, especially for children who are living on the margins?
Yeah, absolutely. And I think these children on the margins, parents are living on the margins. And with parents living on the margins, it actually, oftentimes they cannot afford tutors. And these parents will not be also unable to go to work themselves if they're forced to stay home to take care of their young children who cannot virtual learn. And altogether, whether it's hunger, whether it's homelessness, evictions, all of these things will have a cascading effect. And so it's not just the emotional, psychological, intellectual development, but their actual family's development. So this is why we actually need childcare for all, not just Medicare for all. We need healthcare and childcare for all in this country. And right now, that is further exacerbating how vulnerable the U.S. is as a society.
So what we need are all-around comprehensive, very holistic solutions to this, not just seeing this in a very sort of simple way, thinking that return to schools will lead to economic recovery. So, well, really then, Dr. Ding, how would, for schools that do have to reopen their classes, how should they go about doing so in a way that's safe for both their students and their teachers?
Yeah, I think we should think about wherever we can, outdoor classrooms as much as possible. We need to rethink ventilation. As we say, the solution to pollution is dilution, or ventilation in this case, with virus that has aerosol properties. And unfortunately, a lot of our classrooms just are not fit for that. So we need an enormous amount of school investment to revamp all of our old classrooms in schools, because whether this pandemic risk will not be solved overnight the day that the vaccine is released. It will be with us for at least another year or two. And we need to start now to put in that investment so that we can fuel our economy by having schools reopen. But without that investment, we're going to be in this purgatory of up and down closures, quarantines, lockdowns for quite a while, even after the vaccine is first available.
So we really need a well thought out long-term approach to this. And well, Dr. Mahoney, then how can the government make sure that marginalised students don't fall further behind?
So I think here it's a question of political will, that we have, I think, strong evidence on how to improve outcomes for marginalized students. And so far, there hasn't been political will to put in place more teachers, more resources, longer school days, longer school years in lower income communities. I think we should view coronavirus as sort of a wake-up call that these gaps are increasing, and I think now there is no more time for delay to invest in all of the communities in this country to improve educational outcome.
Well, this is where we wrap up the discussion today, but it was incredible hearing your insights. That was Dr. Eric Ding, epidemiologist and senior fellow of the Federation of American Scientists, and Dr. Neale Mahoney, professor of economics and policy at Stanford University. Thank you so much for joining us.
Thank you for having me.
And to our viewers, thank you for watching. Have a great day or evening wherever you are. Goodbye.